Good evening, everyone, and welcome to the Tele-Health Education for Your Health Awareness Campaign Talk Series, the FACTS Initiative 2020-2021, which is an inaugural virtual public health education program, an academic community partnership among the International Community Initiative, the Maryland Rural Health Association, and the University of Maryland Eastern Shore School of Pharmacy and Health Profession. It is my honors and pleasure to be your host again this evening on this episode. A little bit about the mission of our organizers and partner, ISI mission, the Maryland Rural Health Association mission, and the UMES School of Pharmacy and Health Profession mission statement are provided for your information. In the interest of time, please visit our website for more information about each of our partners. The mission of this program is to promote healthy habit and raise awareness through an interprofessional collaboration and telehealth delivery of health information for the community. The goal is to provide accurate health information, resource, and strategies based on selected health topics of the National Health Observance to promote health and prevent disease. This is a monthly 30-minute telehealth education episode delivered via YouTube channel, starting back in September 2020 and then continuing on to the 5th episode today. For more information about this program or to volunteer with us, please contact myself or our partner, Ms. Lara Wilson at the Maryland Rural Health Association. The topic for this episode is Cardiovascular Disease, What is Your CVD IQ? In celebration of American Heart Month in February. We also have the next episode listed for your information. It's now my pleasure to welcome our speaker for this evening, Dr. Sharon Saunders. Dr. Saunders is a board-certified internal medicine with added qualification in geriatrics. She's a member of the Maryland Commission on Aging and Maryland Response Medical Reserve Corps. She was recruited by Baltimore County Health Department to help with the opiate epidemic, and recently she also became involved with the COVID-19 pandemic. Please help me welcome Dr. Saunders as our speaker for this evening.
Thank you so much, Dr. Truong. It's a pleasure to be here with you all and to celebrate this February as American Heart Month. Next slide, please. The objectives of the presentation are to identify cardiovascular disease as it is a part of our lives from head to toe of our bodies, to recognize populations which are particularly at risk for cardiovascular disease, and to know the warning signs of heart attack and stroke, the emergency aspects of cardiovascular disease, and to provide you with strategies to decrease the risk of cardiovascular disease. Next slide, please. So as we've just said, February is American Heart Month, and this February 2021 marks the 57th consecutive American Heart Month. Okay, so now it comes the IQ, the CVD, which is cardiovascular disease IQ quiz. You've got a couple of them, but we give the answers right away. So how did American Heart Month get started? President Lyndon Johnson, who was a heart attack survivor, issued the first proclamation in 1964, declaring February as American Heart Month. It has grown over the years to include events of cardiovascular disease awareness for everyone, but particularly recently to increase the awareness of heart disease in women. As we go through the talk, I'll talk about the Go Red for Women initiative. I'll talk about goredforwomen.org and talk about the first Friday in February as being the National Wear Red for Women Day. As you can see, I'm wearing red because of this talk. So I'm continuing that, extending that day through the whole month. There's also a red dress collection, which includes celebrities and a catwalk event. For those of you who are not familiar with the term catwalk, think about designers, dress designers, and the runways and very fashionable events that occur. And this is part of that, and we'll talk about this a little bit later. I will also talk about the opportunities for people who sew and who knit and who crochet to be part of American Heart Month as part of the Heart Truth of the National Heart, Lung, and Blood Institute. Next slide, please. Okay, so here comes another quiz. Do you know how many blood vessels there are in your body? How many miles there are in total? Can you tell me if heart disease is the number one killer for men or women, or is it both? Did you know that young people can die from cardiovascular disease as well as older individuals? And did you know that you can make changes in your life to decrease your cardiovascular disease risk? Okay, I'm listening to hear everybody write their answers down. Let's have the next slide and we'll get the answers. So how many miles total of blood vessels do we have? And I'm talking about arteries, about veins, and about capillaries, the very small bridging vessels between arteries and veins. The human body's circulatory system is between 60,000 and 100,000 miles, depending on the body size. A very smaller woman would have closer to the 60,000, a very larger man would have closer to the 100,000. And children are closer because of their small size, closer to the 60,000 miles. Again, we've been hearing about Mars and all of the excitement about landing on Mars and how long it will take for information to get back. So when we think about the distance, 100,000 miles is quite a bit. What does that represent? It represents 2.5 to 3 times the Earth's circumference, right around the waist of the Earth. One of the things that can increase the amount of blood vessels is excess body weight or fat. Fat has quite a bit of blood vessels embedded in it. Every pound of fat adds 5 miles of blood vessels. Well, why is this important? Because a heart beating 100,000 times a day will pump blood 500,000 miles per day extra, just for 1 extra pound of body fat. You're talking about requiring your heart to do a lot of extra work that it really is not designed to do. So consider that when we are looking at what our scale is telling us about how much weight we're putting on. Okay, for the answer to the question number 2 on the quiz. Heart disease, remember we said, is it the number one killer for men or women or both? Heart disease is the number one killer for men and for women. And I'll give you some numbers for that a little bit later. The third question was, can young people have heart attacks? And the answer is yes. People as young as 20 can have a heart attack and die from cardiovascular disease. And the last question was, is there anything I can do to decrease my risk of cardiovascular disease? And the answer is a resounding yes. You can change or modify your lifestyle, and this will decrease your cardiovascular disease risk. And that will happen no matter where, if you're young, if you're middle-aged, if you're older, you can make an impact, a positive impact on decreasing your cardiovascular disease risk. Next slide, please. So is cardiovascular disease important? Well, I think we've just established that, but what are the numbers? How important is cardiovascular disease in our life? Cardiovascular disease is the number one killer of Americans, and the numbers are actually very, very important. 1 out of every 3 women will die of heart disease, and 1 out of every 4 men. Now, putting this in perspective for the women, which emphasizes why recently more emphasis has been placed on women understanding about the importance of cardiovascular disease in their lives. If I were to stand in the shopping mall, say, and ask women, what is the number one killer? A lot of women would say breast cancer or ovarian cancer or some disease that is mostly specific to women. And while these illnesses are very deadly and we are very concerned about them, it's actually heart disease, which is the number one killer. And most women are not as aware of that. as we would like them to be. Cardiovascular disease, the burden, cost about $1 billion per day. And we're talking about surgeries. You're hearing about people having bypass grafts, but also people, especially those who have diabetes and have peripheral vascular disease, who have poor circulation in their legs or in their feet, that may require an amputation. That adds to the expense. The disability costs are very high, as you can imagine, when we have these kinds of surgeries happening. Suppose someone has a stroke, the disability that may mean that they can't live on their own or that they have less mobility. Cognitive decline. The recent studies are showing that cardiovascular disease is very much connected and directly correlated with problems with memory. And we'll talk about blood pressure in particular being a factor for that. And also that permanent damage can cause heart failure, which increases the likelihood that the person is less able to be active. The bottom line for all of these things is that our quality of life and our quantity of life decreases. And just recently, it was shown that in America, for the first time in many years, we have lost the longevity. We've lost years of life. Whereas before we had been gaining years of life through good health care, but now that's turning around. Next slide, please. Who are at risk? Well, if you look at this slide, it's pretty much everybody, men, women. Again, we talked about heart disease being the #1 killer for men and for women. People who are young, people as young as 20 can have a heart attack. People who are older, but also racial and ethnic minorities and people who are overweight and obese. And the last two categories sometimes go together. And we're going to talk specifically about what can be done and why these two groups are more at risk. Next slide, please. So I've got your attention now about it's the #1 killer for men and for women, the different groups that are affected. What exactly is cardiovascular disease? It's any abnormality of the heart and blood vessels. We're talking again about the arteries, the veins, the capillaries, the heart. Coronary heart disease are mostly the arteries of the heart that are affected, and you've heard of people having heart attacks and that they have blockage. These conditions develop over years. What we find is that for women in particular, when they go through menopause and the estrogen level decreases, and that's around between ages of 40 and 60, that this risk really rises fairly sharply. But the atherosclerosis, or the hardening of the arteries, can really happen at any time. The cholesterol and the fat in the artery walls create a blockage, and blood clots can form. Next slide, please. The specific types of cardiovascular disease, we've gone through talking about heart attack, where you get a blockage in the vessels of the heart, the artery, the muscle. The heart is a muscle. The muscle that is behind that blockage is not getting oxygen. It's not getting a blood supply, and therefore it dies. And that's where you can get heart failure. You can have parts of the muscle of the heart that is not working well, and that can increase the disability we talked about earlier. A stroke, it's the same kind of mechanism. In the brain, if there is a blockage, the part of the brain that gets fed from that vessel is not getting oxygen, it's not getting blood, and the brain that is served by that vessel then dies. And that's when we start to have the symptoms, and we'll talk about symptoms of a stroke afterward. Peripheral vascular disease. Typically, we're talking about the legs and the feet, and especially in diabetics, where the blood vessels are affected in particular, you may find that the tissue dies. You hear about gangrene, where the blood vessels are not feeding the tissue properly, which can result in amputation of the foot or the leg. There's another one that I wanted to bring up that a lot of people don't know about or talk about so much. It's called Berger's disease. And it's not the most common, but when it happens, it's that the vessels in the hands and in the feet and the distal extremities become inflamed. And it's always in regards to exposure to tobacco. So somebody who has a predisposition for the Berger's disease, and again, it's not a very common entity, but those who are predisposed to it, if they smoke cigarettes, but also if they chew tobacco, just chewing tobacco, the tobacco itself, the nicotine gets into the circulation, or if they smoke cigars, any exposure to tobacco can cause this inflammation in the hands and the feet. It can result in amputation because the tissue that is affected is not getting the proper blood supply. And as I mentioned earlier, more and more research is showing that people who have problems with cognitive decline, that their memory is not as effective. Blood pressure in particular has been shown to be associated with this, but also people with their cholesterol and other fats in their body. So it's important that we know the specific types of cardiovascular disease, what we might be at risk for when we talk about how we can decrease our risk. Next slide, please. I want to talk about the emergency aspects of cardiovascular disease, heart attacks and stroke. And we're going to go through the symptoms in men and the symptoms in women, because that's something that I think all of us need to know. Heart attack symptoms in men can be chest pain or a squeezing sensation in the chest. I've heard some people say, gee, it feels like an elephant is just sitting on my chest and really just causing a lot of pressure. It may come and go. And I'm going to emphasize that. I'll say that a second time. It may come and go, because sometimes people will feel that sensation. And then if it goes away, they think, oh, everything is okay. And then it may come back and stay. And they should have been going to calling 911. They should have been going to the hospital. So the coming and going is not an indication that this may go away completely. And it needs to get your attention. The left arm may have pain, or the jaw may have pain. Sometimes somebody just notices that their heart is beating a lot faster than it normally does. It can also be taken for an upset stomach discomfort. Sometimes somebody says, gee, what did I eat? This is really bothering me. They may get short of breath or dizzy, or the person may break out in a cold sweat. So there's nothing in here that the heart says, comes out with a neon light, says, hey, I'm having trouble here. It's more symptoms that make you aware once you know what to look for, or to have your antenna up and to be, or somebody is exhibiting these signs in front of you that you are aware of this. Next slide, please. In women, they may have the same symptoms as men, and that's why I went through the men first, because it may be very classic. Those other symptoms in men are what they call the classic symptoms. But women, and nobody knows exactly why, sometimes women have different symptoms. There's been discussion that women, because of smaller body stature and the vessels are smaller, they may be different, but there are sometimes different symptoms for women that people don't always recognize. They may have more dizziness or nausea. Again, feeling that maybe something I ate didn't agree with me. Unexplained weakness. And I'm going to give an example here. One of the medical students at University of Maryland had come home for a spring break, and her mother, who was usually a dynamo cleaning the house, she loved to run the vacuum and was very energetic. Her daughter, the medical student, noticed that her mother was sitting down several times just cleaning one room and saying, oh, I need to catch my breath, and oh, I must have done too much. Well, this was a smart medical student who, after about the second time the mother was sitting down, said, I think that you might be having problems with a heart attack, and we're going to the hospital. And the mother protested, but the daughter was very firm. And sure enough, the mother was having a heart attack. So you imagine that what would have happened, what potentially could have happened to her if her daughter, who was not aware of these different symptoms. The sense of impending doom, and then that's kind of vague, but just the feeling that things are not right, and I feel very, very discomforted, and I'm very, very upset. Again, the recurring chest heaviness, the elephant sometimes that the guys may also notice, or discomfort. Sometimes for women, rather than the jaw or the arm pain, the discomfort might be in the shoulder blades or the upper back. So for women or somebody who's listening to somebody, a woman, recognizing that it doesn't always give the classic signs. The next slide, please. Let's talk about stroke symptoms. Again, these are the emergency cardiovascular disease entities, which I really want you to be aware of. You might have the brain is involved, and all the areas that the brain is in control of are affected. The person may have difficulty walking. They may start to fall down, and problems with coordination with their hands or with their legs. They may say, gee, everything is blurry or double vision, whereas they didn't have before. Or if they're talking to you, they may start to have garbled speech, a speech impairment. They're not making sense. They're reaching for something and their hand just drops, or their arm just drops, if they have limb weakness. Or their face may droop, and it may only be one side of the face which is drooping. The person may be showing confusion. One minute they're talking to you, making sense, and next thing, what they're saying is not at all connecting. Or they might just feel that they're fatigued or lightheaded. Again, it doesn't have to be very specific. My dad had a stroke, and we talk about how fortunate it was that it was at the holidays, that he was out shopping. It was at Christmas time, and he happened to be in the mall. And when he fell down, had trouble walking and fell down, fortunately, 911 was able to be called, and the paramedics were there very quickly, and he was able to get treated and was able to recover completely. We were very, very fortunate. Had he been at home and no one around, the outcome may not have been so good. Next slide, please. So I've told you about these emergencies. What should you do? We talked about sometimes some of the symptoms coming and going. Don't wait. Waiting may cost you your life. Don't wait. Call 911 within minutes. Some people are saying 5 minutes at the most. Don't hesitate. It's better to let the emergency personnel evaluate you and decide if you need treatment than for you to say, gee, I don't want to bother anybody, or maybe this isn't so bad, or maybe if I wait a bit, it will just kind of go away. Let the emergency personnel, they will always tell you, we're so glad that you called us. If it turns out to be that it is indigestion rather than a heart attack, you can get treated for that. But they will always tell you, we're really glad that you called us. Don't drive yourself to the hospital. If you are driving and that your heart stops beating, or if it's a stroke and you have trouble with vision, you may cause an accident and hurt yourself or someone else. The warning signs that I just gave you, learn them, remember them, review them, and don't ignore them. One of the things that's very, very important is for hands-only CPR, cardiopulmonary resuscitation. When CPR first came on the scene, it was pumping on the chest and breathing into the mouth to give the person air. Well, that's still the gold standard, or providing a bag valve that the paramedics may have. But people have become concerned about diseases that they might get by putting their mouth on somebody else's mouth. So studies have been done which shows what happened if I only do the compressions, if I put my hands on the chest, I don't worry about the mouth, and I just compress. And studies have shown that doing this right away before 911, the paramedics are able to get there, improves the individual's chances much, much more than doing nothing. I gave you the link here for the American Heart Association. The Red Cross also has a video. I think it's 2 minutes on YouTube to watch how it can be done. You can really improve the chances of somebody coming through in a wonderful way by learning hands-only CPR. So I wanted to take that moment to make you aware of this change in how the emergency response is done and how you can make a difference. Next slide, please. So we talked about the risk factors and what, so now we get to the point of, well, what can I do? You're telling me all these things that can happen, but is there really something that I can do? Well, there are some things we can change and some things we can't change. So the non-modifiable, modifying means to change. Non means I can't change this. Well, what is that? Your family genetics. If you have a family history of heart attacks, if you have a family history of strokes, if you have a family history of high lipids, you can't change that that family history. But we will talk in a little bit about what you can do to improve those risk factors, to decrease the risk. Your gender. I can't change that I'm a woman. We can't change a man that, again, the 1 in 3, 1 in 4 of a heart attack. We can't change that. We can't change the age. We can't change our race or ethnicity. And we talked about the risk factors being more in minority communities. And actually, even for COVID-19 has increased the risk. And we can't change that right now. We're working on it with the vaccines, but right now we can't. Next slide, please. But there are modifiable risk factors. I can change this. Lifestyle. What can I do in my life to make the risk factors the least they can be? Pretty much at the top of the list is smoking. If you smoke, now is the time to quit. We're in the new year. This is a time, even though it's February, it's not January, but you can start this. It's important not only for yourself, but for those around you. Recently, the increased risk of secondhand smoke, somebody who is not smoking, but they're breathing in the smoke of those around them who smoke, they are finding that the impact on cardiovascular disease is significant. So you're helping yourself, but you're also helping somebody else when you stop smoking. Diet. We're not talking about the fad diets, this or that. We're talking about increasing fruits and vegetables in your diet. Half of your plate should be fruits and vegetables. Increasing the amount of fiber in your diet. Looking to decrease processed foods, foods with a lot of fat or fried foods. There are all kinds of, if you go to the Heart Association website, and I'll give you the link for that, there are all kinds of information about the Mediterranean diet, the DASH diet, decreasing the amount of salt that you take, increasing the your blood pressure. We'll talk about that in a moment. Increasing your physical activity, 30 minutes a day, pretty much every day of the week, is what is needed to decrease your risk factor. And we're not talking about somebody who's getting involved in a marathon. I used to tell my patients all the time, walking is really good, but not window shopping walking. I want you to walk as if there's something big with teeth behind you walking. And they got the idea that I want them to move along a little more briskly. Getting adequate sleep. 7 hours minimum, 7 to 8 is great, but making sure that you get good sleep. And somebody who has sleep apnea, to make sure that they get evaluated and treated. That has increased the risk of heart disease. Sleep apnea, somebody will say, gee, I'm tired always the next day. And somebody who's watching this person sleep will say they stop breathing periodically during the night. These are tip-offs that you might have sleep apnea, and you need to discuss that with your healthcare provider. Again, the modifiable COVID-19, wear the mask. wash your hands, social distance. These are the kind, get the vaccine, get the vaccine. These are the kinds of things that we can do to improve our risk factors. Next slide, please. So the old adage of an ounce of prevention is worth a pound of cure holds very much so for cardiovascular disease. We talked about the amount of fat, the blood vessels, how much harder your heart had to work for the just 1 pound of fat. Maintain a healthy body weight. Balance the calories that are eaten with those used in physical activity. If you don't drive your car, and now today a lot of us are not driving as much, you don't put gas in your car. If you're not using up the gas that's in your car, you're not putting in new gas. We are no different. Quit smoking. They have the patch, there's a nicotine gum, and for some people, hypnosis has been very effective. Manage your diabetes. Work with your healthcare provider. Do the things that are needed to be done to maintain a good blood glucose. And we'll talk about the numbers in just a moment. Take your medications as prescribed. If you find that the medication is not agreeing with you, don't just stop it. Talk to your healthcare provider and say, I can't take that medication 3 times a day. Is it possible to find something I can take once a day? Find ways to make it effective for you. And that goes right into getting an annual physical exam. Your risk will be discovered at that time, and the healthcare provider will help you go through the areas that need to be addressed. Is it your blood pressure? Is it your weight? Have you gained weight since last year? What is your blood sugar doing? Next slide, please. So you need to know your numbers. And I recommend taking a small notebook with you when you go in for your physician or nurse practitioner or physician assistant appointments, your healthcare provider. Write it down and keep track. I'm giving you the optimal numbers. These are the best. These are the best that you're aiming for. We know that we don't always get to the best, but we keep trying. And these are the numbers that you want. For blood glucose, your optimal fasting level is less than 100 milligrams per deciliter. The hemoglobin A1C, what is that? It is a measure of the 3 months of your blood glucose control. I used to tell my patients, I know you knew that you had an appointment today, so over the weekend, if it's a Monday, I said over the weekend, you probably didn't eat the things that you normally eat. So when you come in on Monday and I draw your blood, everything looks great. But the red blood cell lasts for 3 months and it gets coated with the glucose. And the higher your blood glucose is, the more the coating. And you want a lower number, a lower coating. So the optimal is less than 5.7%. Your lipids, or the fats in your body, you want your total cholesterol to be less than 200 milligrams per deciliter. But there is good cholesterol. That's the HDL cholesterol. And that one, everything else is less. The HDL, you want that to be more. And you want that to be higher than 40 milligrams per deciliter. One of the things that you can do to raise that is exercise. So keep that in mind. BMI, what is that? I've heard of those three letters, and people seem to focus on that now. That is body, M is mass, MASS, and then I is index, body mass index, and it is a ratio of your weight to your height. So somebody who is 6'2" and 100 pounds, weighs 100 pounds, is going to look too thin. Someone who is 5'2", a foot shorter and 100 pounds looks just right. That is body mass index. It is your weight to your height. And less than 25 kilograms per meter square is where you want your body mass index to be. Blood pressure. And blood pressure is so important, it gets its own slide. Can I have the next slide, please? It used to be that there were only 1 or 2 numbers for the blood pressure, and you were either on the right side of it or the wrong side of it. Now blood pressure has been divided into grades of where you want your blood pressure to be and the risk of cardiovascular disease based on these blood pressures. So we know that the systolic, there are two parts to blood pressure. Systolic is when your heart gives that hard pump initially. The diastolic is when the arteries, which are elastic, give a little extra kick at the end. A normal blood pressure is less than 120 and less than 80. 120 for the systolic, 80 for the diastolic. Elevated, and you can see yellow, just like, so green is, it's just like looking at a traffic light. Green is good, green is go. Elevated is yellow, caution, we need to watch this. The blood pressure, the systolic between 120 and 129, and the diastolic less than 80. The orange, you have high blood pressure. It's in stage 1, so you're just over that line. But that's the systolic blood pressure of 130 to 139, or the diastolic being 80 to 89. So now we're starting to see that bottom number become such an integral part of the worry and the concern. Your doctor may start talking to you if your weight is elevated, if your diet is not optimum, that you're eating a lot of salt, a lot of fried foods, a lot of fatty foods and greasy foods. You may be able to alter and bring down your blood pressure. That maybe if you're not exercising regularly, you may be able to make those adjustments and bring down your blood pressure. If your blood pressure, though, is stage 2, which is 140 or higher for the systolic, or 90 or higher for the diastolic, you're going to need medication. And I would always tell patients, the medication is something to decrease your risk and to make sure that you are protected while you are putting in these lifestyle changes that we talked about. Again, someone who has not been exercising, someone who has allowed their weight to be suboptimal, that BMI is over 25 kilograms per meter square. Maybe they can, that's a lot of work, but sometimes you can get off the medication. If not, it's not a failure. The medication is there to help you. So pay attention to what the doctor is telling you. Use that medication in conjunction with these other lifestyle changes. And then we talk about a hypertensive crisis. This is when you should consult your doctor immediately, because the amount of pressure on those vessels is very, very risky and can cause serious damage. That's when the systolic is higher than 180 or the diastolic is higher than 120. Next slide, please. February is also Black History Month, and we talk about race and ethnicity and racial disparities in cardiovascular disease. We find that chronic diseases are more common in the minority community. Chronic means long-lasting: diabetes, obesity, high blood pressure, high cholesterol. You are now experts knowing that these are all connected with risk of cardiovascular disease. Obtaining health care and maintaining health is more difficult in the minority community, and it's also more difficult to achieve a healthy lifestyle in the minority community. Some of you are familiar with the term food deserts, meaning that it's hard to find fresh fruits and vegetables in a minority community. It may also be more difficult to exercise in a community if it's not as safe. So these are reasons why race and ethnicity can be part of the increased risk of cardiovascular disease. Next slide, please. Let's talk about the ladies for a minute. Again, as we talked about in the last several years, women and heart disease. Why is it so important? Well, we talked about cardiovascular disease, heart attacks, 1 in 3, every 3 women. Looking at celebrities such as Cameron Hall, Star Jones, who have joined with the CEO, Nancy Brown of the American Heart Association, and the professor of Molecular Physiology Institute, Swati Shah, people are starting to focus on women and making women more aware of their risk of cardiovascular disease. Next slide, please. The Go Red for Women initiative by the American Heart Association. We talked about the red dress collection. It's a catwalk event. You should see some of these dresses, and you can see it when you go on the American Heart Association website, and I'll give you that link later. Tamron Hall, Shania Twain, Robin Givens have been part of this, and the dresses and that they have are absolutely eye-popping, I have to say. National Wear Red for Women Day, again, the first Friday of every February. But as I'm showing you today, you can wear your red proudly the whole month. The GoRedForWomen.org, you can look at that red dress collection. Other groups who have gotten involved in the women and heart disease include fiber arts and sewing communities, which support the Heart Truth, which is the National Heart, Lung, and Blood Institute, NHLBI. That is their focus on women's health. There are 3 books, Knit Red, Crochet Red, and Sew Red. They contain projects, information, and personal stories from top designers who design special projects, sweaters and scarves and quilts for people, and they talk about how heart disease has affected them or somebody in their family. And proceeds, a portion of the proceeds from each of those books supports the Heart Truth. So it's really a fun thing to enjoy for ourselves and do something good at the same time. Next slide, please. The National Heart, Lung, and Blood Institute, NHLBI, talks about how to modify risk factors. They give quite a bit of good information about eating a heart-healthy diet, how to increase physical activity, particularly in your home, around your house, how you can do that in a way that's convenient, how to maintain a healthy weight, knowing and controlling your heart health numbers. And we talked about that, knowing your numbers, your blood pressure, your BMI, your body mass index, your cholesterol, your glucose. Recommending that you get good quality sleep, reducing stress, and of course, to quit smoking. Next slide, please. So do you want to know more? Have I gotten you excited about saying, I can do this. I can modify my risk factors. I can learn more. I can look at the CPR. If you go to the American Heart Association, www.heart.org, the CDC has information about American Heart Month. And as you can see at the very end, it says heart disease and it says any age. All of us can be a part of this. The Health and Human Services, HHS, has an initiative called Million Hearts. And of course, the NHLBI has, that's the National Heart, Lung, and Blood Institution, nhlbi.gov. I hope that today's talk has allowed you to learn more about cardiovascular disease, how it impacts your life, how you can do things to improve your risk factors, and how you can help those around you if there's an emergency, how you can make recommendations for their life, that all of us will lead the best lives possible. I thank you very much for your attention and for letting me be a part of your evening and your afternoon. Thank you.
Thank you so much, Dr. Saunders, for a very informative and empowering presentation for us to share with our loved ones and hopefully be able to protect them as well, not just in February, but throughout the year. With that, we thank you for joining this evening, and we hope to see you at a future episode. Look forward to February to March will be Women's Health Month, so we shall return in March with a topic for you regarding women's health. Have a good evening.